A report recently surfaced about a certain famous Kourtney Kardashian being put into early menopause due to her IVF treatment. I thought this was a really interesting topic, particularly because, first of all, early menopause doesn't usually get a lot of social media attention, but also because this is a really important question to address. Many women are delaying childbearing for many reasons, and they're either doing egg freezing or they're undergoing embryo transfers or other forms of IVF. So I wanted to answer the question of, can IVF treatment cause an earlier menopause and perimenopause, and what can you do about it? My name's Dr. Heather Hirsch. If you have landed on my channel for the very first time, hi and welcome. I am the menopause director at the Brigham and Women's Hospital and faculty at Harvard Medical School. And here over on YouTube, I post tons of content and videos on both perimenopause, menopause, low libido, bone health, and preventative health. I am also the course director of the Reclaiming Menopause Masterclass, more at the end, and host my own podcast as well. Enough about me, let's get right into what you came for, which is, can IVF treatment cause early menopause? Before we get there, I want to start off with some definitions that are really particularly important. Early menopause is defined as menopause between the ages of 40 and 45. And I do have a really good video here I did about what you need to know if you are going through early menopause. And importantly, premature menopause is if menopause is before age 40, and I have another good video here. A lot of premature menopause falls under premature ovarian insufficiency, and both of these conditions, women often do have trouble getting pregnant. Those definitions are really important because how we're going to treat you is really much different. Now, perimenopause, on the other hand, is the time leading up to menopause, and this is a really important time because it's when that estrogen level is starting to slowly decline and can cause lots of symptoms of menopause. But by the textbook, menopause is 12 months without a period. So if you're experiencing things like hot flashes and dry skin and trouble sleeping and low libido and all those classically menopausal things, but you're still having infrequent periods, you could be in perimenopause. The reason I want to tell you those differences is because as we get into what is potentially going on with Kourtney Kardashian and other women undergoing IVF, I think setting these definitions is really important. Now, we know that certain medications can cause the ovaries to shut down and stop producing estrogen. A classic example of this is the medication Lupron. Lupron is often used for something like endometriosis, or often it's used for women who have estrogen receptor positive breast cancer to basically put those ovaries to sleep and slow or stop the production of estrogen. Now, I bring up this example of Lupron because I wanted to really demonstrate that there are medications that can be used to sort of either temporarily put someone into a menopausal state, or if these medications work really well, sometimes unfortunately they can really cause those ovaries to not wake up even after those medications are stopped. And we don't know why that happens, but again, the female body is a little bit of an enigma. Now, is it common that IVF medications lead to early menopause or perimenopause? Well, to be totally honest, I really don't know. At the filming of this video, there's a lot of information about perimenopause, particularly because it really lies in that gray zone between, premenopausal and menopause that we don't know about. However, what I will go on to say is that I do see a lot of women in my clinic who have undergone IVF types of treatment, and they feel as though it may have put them into an earlier perimenopause or early menopause. Now, why that is, I don't know. I bring up the example of the Lupron because there's certainly lots of hormonal medications being used during IVF treatment. There's first the process of getting your eggs or egg retrieval, which a lot of times the doctors will give you a good amount of estrogen to cause you to really have those oocytes pop up so they can go in, basically take them out, and sometimes freeze them and sometimes use them. Then there's also the embryo transfer, where after they've put the egg and sperms together, they're going to reimplant it in the woman's uterus. And after that, she's going to take some hormonal medications to sustain that pregnancy. That is a very simplistic and brief overview of IVF because I'm not an REI clinician, which stands for Reproductive Endocrinology and Infertility. However, what you can see is that there is definitely a lot of hormonal trickery going on, right? We're kind of stimulating your body and then trying to give you hormones that are going to allow for implantation. What I sometimes wonder is if that maybe causes the ovaries to just kind of want to take a nap or a rest. And I don't know if some of those medications also then cause you to go into a little bit earlier menopause or perimenopause. But it's also what came first, the chicken or the egg? Is it also that we're undergoing IVF because we have something called diminished ovarian reserve, which is basically just the oocytes or eggs that we have left are really not so viable. The other bias that I sometimes wonder about is that certainly a lot of women probably undergo IVF and do well and don't see me. So sometimes if I say I see a lot of this, it could just be the nature of what I do as being a consultant and seeing women with early perimenopause and early menopause. Now, the definition of menopause is 12 months of no period, and that's really, really important to distinguish perimenopause from early menopause. But let's say in the case of Kourtney Kardashian, it really is true that as she was undergoing her treatments, and I don't know what they were, and I'm certainly not her doctor, but this is for educational purposes. Let's say she was going through that and really it's been, 11 or 12 or 13 months without a period. And she's about 42 or 43, so that would really mean she is in early menopause. Now, could her periods come back or resume? I wouldn't be surprised, and I see this quite often, especially if we use hormone therapy. Now, hormone therapy is absolutely the gold standard of care for women who have either premature menopause before age 40 or early menopause, which is menopause between ages 40 and 45. Assuming a woman has an intact uterus, which means she hasn't had a hysterectomy, that means she's going to want to need estrogen plus a progesterone. And the main role of the progesterone is to protect her uterus. And the estrogen helps with so many things. Now, not just what you're thinking of, which is preventing hot flashes and keeping your skin glowing, but the reason that hormone therapy is the gold standard of care for women who have early and premature menopause is because we know that without estrogen, losing it early can increase your risk for cardiovascular disease, increase your risk for bone loss, potentially cause changes in cognition and brain health, changes in pelvic floor, and finally changes in sexual health. So the gold standard of care is to really put those women on hormone therapy replacement. And then again, as I said, sometimes hormone therapy can cause a woman to have a period. And so then is it perimenopause or early menopause? Or sometimes periods can absolutely resume, even in the case of premature ovarian failure. I see that all the time. And that's why we now call it premature ovarian insufficiency, because we know that it is not really always permanent. So I hope that was helpful. And what I wanted to do was shed some light on this topic, because if you're undergoing IVF and you see this type of report, it doesn't mean that this is definitely going to happen to you. However, what I do think that this means is that we really need to take a look at what happens to women after IVF, hopefully with a successful pregnancy, but after you have a baby or you're done breastfeeding, what does happen between the interval between premenopause and perimenopause, or how many women do go into menopause just because of the risks of medication with IVF. Also, ultimately, if you're diagnosed with menopause before the age of 45, you should be started on hormone replacement therapy. If you're stuck with perimenopausal symptoms or you have early premature and menopause and you want to get help with me, definitely consider booking a call to see if you want to join the Reclaiming Menopause Masterclass. This sisterhood is growing really rapidly. And what I do is help you figure out exactly what you need, exactly what's going to help you thrive in midlife and in menopause. Don't let the name fool you. I have many women in my masterclass who are in perimenopause as well as menopause. Thank you guys so much for continuing to watch the channel. I love hearing that you guys really enjoyed these videos. Thank you so much, because I love knowing that you're liking the video, subscribing to the channel. That allows me to carve out more time to make these types of videos for you. Have a wonderful week, everyone, and I'll see you next Monday for a brand new video. Bye, everyone.